Okay, this is wonderful. Hi, Julie.
Hello.
It's great seeing you.
You too.
Thank you. Uh, the next section is headed up by Miss Julie Riecken, uh, a very familiar face and friend, and I'm very anxious to hear her experience that she's about to share. So if you'll go ahead, Julie.
Very good. Thank you. Before I get started, I want to definitely thank Bob and Marianne for organizing this today. They put a lot of work into this, and I think it's so helpful to be able to connect with other neuroendocrine tumor patients. Before I get started, I just want to preface my conversation by saying that this is just my experience. In my opinion, there's no right and no wrong to liver transplant, but it worked for me. So for my experience, it's been positive. I'm sure it's not for everyone, but I've always handled everything pretty aggressively, and it never hurts to ask or listen to what different options are. And I, of course, did not take this decision lightly at all. This was something that we really, myself and my family, really considered before being listed. So just a little bit of history, and I don't want to spend a lot of time on my history, simply because it's really not what you're here to hear about. But I am a VIPoma, so I was diagnosed. There were already lots of tumors on my liver at the time of my diagnosis. I have been on sandostatin and octreotide acetate since that time. I see Dr. Hike at Nebraska Cancer Specialists in Omaha, and I also see Dr. Odorizio and Dr. Howe did my surgery at the University of Iowa. I did have surgery to remove the primary back in June of 2015, and I have had a couple of VIP crises, which has made it hard for me to control my symptoms. I had serious, severe diarrhea, pretty uncontrollable at times. So that was kind of a concern for me. And I did have PRRT. So my liver transplant actually occurred just a little over 3 months ago, May 15th of 2020. So this is pretty recent experience for me. I want to talk a little bit about, it's not forwarding, there we go, about the transplant process itself. So the first thing that occurred was I was referred for transplant by my neuroendocrine specialist, Dr. Odorizio. So I was in Iowa City back in April of 2019, and we were talking about next steps because I had done PRRT. I had done really well on PRRT, but I knew it wasn't necessarily going to last forever. And he recommended that I consult with a transplant surgeon. Luckily, here in Nebraska, we have a very good transplant center at the University of Nebraska Medical Center in Omaha. And so I visited with them, and they, of course, looked at my scans and so forth right away and called me in to do a transplant evaluation. Now, with the transplant evaluation, you're committing to about 3 days of pretty serious and intense testing and evaluation to make sure that you are a good candidate for liver transplant. As I said earlier, this isn't for everyone. And so they want to make sure that you are prepared, your family is prepared for everything that it has, that will come after the transplant itself. So my husband and I both had to be there for 3 days. They did all kinds of tests and scans, and I saw people that were helping me with whether it be cardiology or respiratory. I saw a psychologist. They want to make sure that you are prepared post-surgery to take care of yourself. At that point, based on all of those tests, I actually did not have any true liver disease. So neuroendocrine tumor doesn't necessarily mean that your liver is not functioning, as Dr. Odorizio and I talked several times about that. My liver was functioning fine. It's just that all of the tumors on my liver were causing me to have major diarrhea all the time, usually controlled, but sometimes I would be in a crisis mode and not under control. So, but they give you a MELD score, and because neuroendocrine tumor patients don't have true liver disease, my MELD score was actually pretty low. The MELD score is the model for end-stage liver disease, and because I really didn't have true liver disease, my score was a 6, and the range is a 6 to a 40. So I started out as a 6. They have to actually give you exception points because my symptoms were horrible. So they gave me exception points, and eventually my score was increased from a 6 to a 25, which means that you're really on the transplant list. So at that point, we had it submitted to insurance. Insurance denied the claim, so they weren't going to pay for it. They appealed insurance, and insurance denied it a second time. After 2 tries, it went to a third-party appeal program, and the third-party appeal, the people who reviewed that felt like it should be approved. So at that point, insurance, the appeal was overturned, and insurance had to cover the transplant, which obviously is a very big deal. Then after that process, my evaluation was in September. Insurance was finally approved right around Christmas of 2019. So it took a good 3-4 months for everything to kind of transpire with that. Then I was listed. And at that point, when you're listed for transplant, you are waiting for a phone call. And you do have to go in once a month for blood tests just to make sure that things are that you're still on track. So I just waited by the phone. I had to have a phone with me at all times. And eventually on May 15th of this year, so just a little over 3 months ago, about 10:30 in the morning, I got a phone call from the University of Nebraska Medical Center, and they had a transplant offer for me. And so they explained the situation, explained that they had the liver there and were ready to do surgery that evening if I was prepared for it, and asked if I wanted to go forward with it. And I, of course, said yes at that point. One thing that helped me decide that I definitely wanted to do the transplant was I actually had spent about 3 weeks in the hospital in February with serious VIP crisis. So that really sealed the deal for me, that once I got a liver offer that I definitely would take it because I had been very, very sick. So because I got the transplant offer in May, we got to the hospital about an hour and a half later. And basically, because it's in the middle of a pandemic, my husband had to drop me off at the door, and I went through transplant surgery pretty much by myself. Of course, my family was available by phone when I needed to talk to them, but as far as actually going through the surgery itself, I was on my own. So the first thing that they did actually when I was ready for transplant was they did a COVID test. So I was tested for COVID almost immediately, and that came back very, very quickly as negative. So the surgery, I went into surgery about 6:30 p.m. I was out of surgery about 11:30 p.m. So it went very, very well. My husband got a phone call at 11:30 at home to let him know that things had gone well. They did not see any additional tumors on my lymph nodes around the liver, so that was very good. So they assumed at that point in time that I was no evidence of disease, but there was additional pathology reports that they did, and obviously another scan. So we weren't absolutely certain at that point, but had a pretty good feel that it was going to be a good result. The hospital stay for me was a week, so I was there for a full week. After about 24 hours, they had me up and walking. It was pretty painful, but I had good nurses that kept me company and made sure that I was doing well. So I was released on a Friday. On the Thursday before, they actually did allow my husband to come in, and they went through all of the details of how I would be cared for at home, my medications, making sure I knew how to fill my pill boxes and things like that. So just a week later, I was actually home and in the comfort of my own home, in my own bed. And obviously, things progress much faster once you're home versus in the hospital. So it was really good, especially given the fact that I couldn't have any visitors. It was really good to be home. So after I got home, because again, we were in the middle of a pandemic, normally they might have you come in for some labs and so forth, but instead I had home health that came in every morning. So every morning for a week, actually 2 weeks, I think, home health care nurse came in, drew blood, made sure that my blood pressure was good, just talk to me, make sure things were fine. The home health care nurse would come in with a mask on. So we're very aware and very concerned about making sure that I stay healthy, because I am on immunosuppressants now, so I am considered pretty high risk, but everyone was great. Also, physical therapy would come in and would help me walk, trying to stretch things out, because obviously I'd been through a pretty major surgery. So we'd walk around my house or walk up the hill and walk back down the hill, not very far, but enough to just get me going a little bit. And like I said, we would have labs done every day. Now, it's important with liver transplant that you have labs done early in the morning, because they then evaluate your levels and will let you know if you need to change any of the medications. So sometimes if your levels are a little bit off, they might have you change the medications up a little bit, maybe add a milligram or take one away to kind of keep it's what's called prograph levels up. Sorry about that. So your medication, the medication that I'm on includes, like I said, Prograf, sometimes called tacrolimus. I have been on steroids. I'm on a lot of different supplements, some antibiotics. Gradually, every time I have labs drawn, they start to reduce the medication. I'm currently just going in for labs once every 2 weeks. So it started out every day, then it was every other day, and eventually they stopped having home health come in, and I actually go into a lab to have my labs drawn now. So I think I started out with about 16 pills in the morning and about 8 or 9 pills at night. This morning I took 10 pills, and tonight I'll take 5. So it really just, again, it kind of depends on where you're at with your levels. Side effects. So obviously there was a lot of pain with the surgery, and I've had a couple of situations where my stomach has kind of hurt. I had headaches for a while. That's mostly getting better. The one side effect that I am not quite over yet is that I do have a lot of hair loss. This is not my real hair. So unfortunately, my hair has really been falling out pretty dramatically. So I'm anxiously awaiting that side effect to start to improve. But for now, hats and hairpiece. So life after liver transplant, obviously there's a lot of other options. I had already gone through PRRT and having the primary tumor removed, and so a lot of things that had to be taken into consideration. The other thing, and like I said earlier, we didn't take this very lightly at all. I knew that if I had a liver transplant, I would be faced with taking medications for the rest of my life. And that's obviously a very big deal. And I'm dealing with a new disease process. So that's, it's something that you have to keep in mind, and why it's probably not for everyone. I did not have any disease outside of the liver itself at the point of my transplant. So for me, it seemed like a good solution. One other consideration is there are different types of livers. It's possible that you, if you're on a liver transplant list, that you could get an increased risk donor where possibly there might be some follow-up that needs to be done, and maybe additional medications that would need to be taken. So that is a consideration as well. And of course, because of the pandemic and just in general, I am on immunosuppressants, which means that my body is being immunosuppressed so that I don't reject the new liver, so that my body doesn't think it's a foreign object and try to get rid of it. As a result, I have a higher chance of becoming sick and possibly being a little bit sicker than the average person if I were to catch something. So obviously you need to be up on your vaccines and stay away from people that are sick. And unfortunately, that means, for example, I haven't been able to hug my kids since I had surgery because they're young adult men and they have jobs and they have lives. And so unfortunately, during this time, I'm being especially safe. So that is something to consider. In a normal scenario, maybe not quite as much, but right now I'm being extremely cautious. There are also some other risk factors to keep in mind. So it's apparently a high risk that people with liver transplant or other transplants could potentially be at higher risk for skin cancer. So I do have to stay out of the sun, use a high SPF, things like that. You always have the chance of rejection, so you have to keep an eye out for symptoms of rejection. And there is a chance, and I went into this knowing that this chance would be there is a chance of recurrence of the neuroendocrine tumor. So it's possible that my liver will actually eventually have additional neuroendocrine tumors on it. So it's just something that we have to be aware of. We'll watch out for with scans and so forth, and monitor things really carefully. Obviously, all of us have to live healthy lifestyles, so it's not as if I'm doing anything different necessarily. Ultimately, the good news, I have no evidence of disease. I was back at work about 9 weeks after the transplant, which is pretty quick. But you know, I was here at home anyway, so I might as well do some work and get my brain functioning a little bit more again. So, but ultimately, the great news is I have no evidence of disease. The diarrhea is gone. So, and I really have had a rough year up to the point of transplant. So I'm very, very pleased with that. And the final thing that I just want to mention is at some point, I don't know really anything about my donor. There's really no information shared about the donor, but I do have an opportunity to write a letter to the donor's family and, you know, tell them a little bit about myself and my experience and the fact that this has been a life-changing experience for me and my family. And at some point in the next few months, I'll be writing that donor letter, and it will go to the family anonymously. And then they have the opportunity to correspond with me if they'd like. So that's something that I plan to do very soon. But really, I really couldn't be more fortunate to be to have really good doctors that have watched out for me and are following up with me and making sure that things are going well. And had a great surgeon, a good experience, and I look forward to being able to really celebrate after all of this. The pandemic is behind us a little bit, and we have some better treatments for that. Then I can really get out and celebrate the fact that I'm doing so well. So, thank you for having me today.
It was great, just great hearing this, Julie. I appreciated it very much, especially your insights. I just want to have them appreciate when you say you were pretty sick, what that meant. When you have this kind of tumor, which is one of the rarest of the rare, it makes a hormone, or really it makes a substance which causes profound, irreversible diarrhea. to the point where blood pressure can drop, you can damage your kidney, and you can die very fast because you lose so much fluid that it sometimes is impossible to keep up with the amount of fluid that you require during an episode. It's been likened to pancreatic cholera, and it mimics it almost to a T. And so, what you suffered before you made this decision, um, was in every instance um, a life threatening event, as far as I can tell. And I've had the fortune at one point to take care of all 19 patients in the United States for 20 years that had this tumor. And they're pretty much the same when they behave badly. And I can also share regarding liver transplants and neuroendocrine tumors. Um, I've looked after 5 patients, and all of them after 14 years are continuing to do very well. Some with a little bit of recurrence in the liver. But when you have what Julie had done, what you do is turn your clock all the way back. And like she said, her only disease was in her liver, but that disease was terrible, and it was enough to cause, life-threatening condition. So I think what's ahead of you is very, very good in terms of your quality of life. I really do. I appreciate that you made that decision because I felt strongly about it. And your disease at the time, from any distance, didn't look like it was very much, but it was plenty,
Yeah.
much more than you needed or anybody could need. So I just want to share that. And I thought your presentation was outstanding. And I appreciate that you shared that with us. Thank you very much.
Thank you. Appreciate it.